Health Talk Show. Listen every Saturday from 4 p.m. to 5 p.m. UK time on our Coco African Radio UK. Join our chair on the Health Talk Show. Listen every Saturday from 4 p.m. to 5 p.m. UK time on Akoko Africa Radio UK. Health Talk Show with Naache. Your health, our priority.
Akoko African Radio UK.
Hello everyone, you are welcome to Akoko Africa Radio UK. This is Health Talk with Atswei. I'm very sorry we are late today. We had a bit of technical issues, but we are good now. Today, our topic is on introduction to antibiotics. And we are very lucky to have the beautiful Geraldine, a clinical pharmacist here to help us go through that. I will welcome you now here, Geraldine.
Thank you.
You're welcome to Akoko Africa Radio UK.
Thank you. Thank you so much for having me.
So if you can, please tell us a bit about yourself, Geraldine.
My name is Geraldine. I just want to thank you all for tuning in. I'm a pharmacist. I qualified in 2018. So I'm just becoming, confident in my career and looking to learn and grow.
Okay. Okay. All right. So you've all heard her. She's a very good pharmacist. I know her.
Thank you.
And we are talking about antibiotics today.
Yes.
So Geraldine, what would you say are antibiotics?
Okay. So antibiotics, by definition, are a medication that's developed to kill or inhibit the growth of bacteria. There's more than 15 different groups of antibiotics, and they differ in chemical structure, and they're used to treat different types of bacteria. They can be effective so each antibiotic can be effective to treat one type of bacteria or multiple.
Okay. And so why this topic of interest? Why do you want us to talk about antibiotics?
Okay, so the World Health Organization, they were looking at the different regions in the world, and unfortunately, Mother Africa, we have the highest burden of antimicrobial resistance.
Wow.
So we have the highest cases, and antimicrobial resistance is growing larger and larger in that region. So that means they're starting to lose their effectiveness, antibiotics, and the rate at which it's going was unforeseen even just 5 years ago. So the rate at which we're becoming resistant is very threatening, because antibiotics are used for so many routine treatments and procedures. So it's used in surgeries, it's used when you're giving birth, it's used in cancer treatment, it's used in something as simple as UTIs and other bacterial infections. So if we're becoming more and more resistant to the treatment that's out there, then naturally these things can become life-threatening.
Yeah. Would you say, like in Africa, because I think you can just go to the pharmacy and just buy antibiotic without a prescription, maybe that's part of the reason why we're having that problem then?
100%, and that was my motivation to bring this forward on this radio show, because I want to bring it to the attention of our people, just to make us more aware and just to make us understand that this isn't, you may go and be able to buy paracetamol, but you shouldn't be treating antibiotics like we do paracetamol, aspirin, all these things. It's a lot more serious.
Yeah. Thank you very much for that. Thank you. So what are the different types of antibiotics?
So like I mentioned to you, there's different classes. So there's the ones, your penicillins, and they're under a group called the beta-lactams. There's aminoglycosides, there's quinolones, it's endless, but there's multiple groups of antibiotics, and they're all developed, like I was mentioning, to treat the different bacteria that are out there in different ways, which I'll go deeper into later on. But people don't know how many there are available, so you may even be taking an antibiotic, just have been sold it over the counter and not even know that, okay, you're taking antibiotics, and that you could be part of this growing resistance.
Okay.
Yes, so I'll go further into it.
All right. Thank you. You are still listening to Akoko African Radio UK, and this is Talk Time with Irene. So how do they work, the antibiotics? How do they work?
Okay, so what these drug companies develop, they basically look at the structure of the bacteria that's causing the infection, and they're kind of antibiotics are split into, they either kill the bacteria or they stop it from functioning or multiplying. So some of them study the structure and they break down the wall of the bacteria. Because one thing we don't realize, bacteria are living organisms. So you're trying to fight something that's living, trying to grow, trying to multiply. So antibiotics come in the way that they break down the wall. And like I was mentioning with beta-lactams, so your penicillins, your cephalosporins, they inhibit the cell wall. They stop it from building, or they break the structure of it, therefore killing the bacteria. And then some of them are to stop them, like I was mentioning, the bacteria from multiplying. So this basically restricts the bacteria's growth and stops it from the infection from getting worse. One thing we also don't realize is there's antivirals, there's antifungals. Sometimes we commonly get those mixed up as well.
Okay.
So as you know, antivirals, those are things to treat things like herpes or shingles, things like that. And then your retrovirals, they treat things like HIV. And then your antifungals, they treat things like yeast infections and things like that. So antibiotics are separated from those, but the way in which they study the bacteria and develop the drug is very similar.
Okay. Okay. So it's not every infection or every this thing that needs antibiotics?
Not at all, not at all. And that's a very important thing, is that are we fighting a virus? Are we fighting a fungus? Are we fighting a bacteria? That's very important, because if you're taking antibiotics for a virus, you're doing absolutely nothing.
Okay.
Most of the time, our body can fight these things on its own. And if we don't give it that chance, so on day one, you're saying, you're jumping to get antibiotics, and you think it will speed up your recovery. If you're not fighting a bacteria, and if you're not using the appropriate antibiotic for that particular bacteria, you're doing nothing except increasing this resistance.
Okay.
Yes. So there's also a categorizing of antibiotics, in that there's narrow spectrum antibiotics and there's broad spectrum antibiotics. So narrow spectrum is treating more, it's becoming very specific to the certain bacteria. Broad spectrum is treating multiple bacteria.
Okay.
So commonly given is penicillins. They're more likely broad spectrum, and it's normally when the doctor isn't too sure what he's treating, what particular bacteria, so he will give you a broad spectrum antibiotic.
All right.
But of course with that, again, you're increasing the chance of resistance. And so if you can, preferably, if there's any doctors there listening, we always opt for the narrow. If we can decipher what bacteria is causing that infection, we stick to the narrow spectrum antibiotic.
Okay. All right. Thank you. So which antibiotic should be prescribed and when?
Okay. So like we touched on, most of the time our bodies are very fascinating. God created us in very special ways, in that we can fight a lot of infections on our own. If we just give the body time, it creates its own natural defenses and it starts fighting the bacteria. But of course you do need assistance from time to time. The bacteria may be multiplying at a rate the body can't counteract, and so the infection is just refusing to go, or it's getting worse. So when you would seek antibiotics is when you've got very clear indication of, okay, it's been a certain amount of days, or the symptoms are growing, the symptoms are worsening at a rapid rate. I could go very, very deep with this. You just, to be honest, it's just important to seek a clinician's advice. That's the main point I'm trying to drive here. Whether it's a pharmacist, whether it's a nurse, whether it's a doctor, whether it's a dentist, they're trained to understand when you should be taking antibiotics and when you should not. And if they give you the advice that you don't need it, give yourself time before you panic and you go and reach for those antibiotics. So you look for infections that are unlikely to clear without antibiotics, or when the bacteria you're carrying is likely to infect others and you want to treat it quickly. Infections that could take too long to clear without antibiotics, or ones that carry serious complications if not treated straight away. So also people at high risk of recurrent infections.
Okay.
So there's people that are at risk of continuous urinary tract infections. In those cases, you would be taking antibiotics they give them prophylactically. So they give them ahead of time at a particular dose. They tell you how to take it, when to take it, and that's to prevent these infections recurring.
Okay. Would you advise someone to take antibiotic for common cold?
Absolutely not. The common cold is a virus, as well as the flu. So sometimes you can get something called a secondary infection. So because the virus is attacking the body, it makes the body susceptible. Your immunity is low. And so therefore, when the immunity is low, sometimes it gives opportunity for bacteria to come along and create another infection. But in that case, you would do it under doctor's supervision. But the initial cold, no. You just tea, paracetamol, rest, and plenty of water, and more than likely you'll be fine.
Okay. You've all heard from her. I didn't say it. Amoxicillin doesn't cure cold.
It doesn't cure headache. It doesn't cure.
Because I know that everyone goes like, oh, can I have some amoxicillin? Can I have some amoxicillin? When you are traveling back home, I remember when I went home last year, I had people who wanted me to buy some antibiotics for them.
Yes.
And then when you go to the pharmacy, I was so shocked. They sell almost without asking you questions.
Without.
And I'm asking myself, do they know what they are treating with this particular antibiotics?
Yes, yes.
So please stop buying antibiotics. You need to see the doctor before you go and buy some.
It's true. And if I know sometimes you can go into the pharmacies and there's not necessarily someone clinical behind the counter, or even the pharmacist that's signed on to the pharmacy hasn't visited that pharmacy in a year.
They are normally not there.
Yeah. And I know I'm assuming sometimes doctors can be expensive and things like that. We have things like the internet now. You know, you can reach out to people, even if you've got a relative somewhere far who's a doctor that you know of. You reach out, they can give you that information. You can look up information, and just seeking clinicians' advice with antibiotics in particular, it's really, really important.
Okay, thank you very much. You are still listening to Akoko Africa Radio UK. This is Health Talk with Atswei. We still have Geraldine here, and so far so good. I hope you are learning something there. I'm learning a lot today. So Geraldine, how should we be taking antibiotics? How should we be taking them?
Okay, so in healthcare, we're taught right patient, right medication, right dose, right administration, right time. Each case is very different. So you're taking into consideration, is it a child? Is it a pregnant lady? You know, even being pregnant, there's certain antibiotics you shouldn't be taking.
Yeah, I was going to ask that. Okay.
Yeah, so being pregnant, there's certain antibiotics you shouldn't be taking. And so it's important to check that with a clinician before you go ahead and take it. Certain antibiotics treat where the infection is. So certain antibiotics fight bacteria that are attacking the upper respiratory system, so the upper chest. Certain antibiotics are for skin infections. Certain antibiotics are for bloodstream infections. And so, again, you can't just take them generally. Sometimes you're doing more harm than good. There's a way to not take them. If you have been given a prescription, or you've been in touch with a pharmacist, a nurse, or whoever, and they've said, take this antibiotic 3 times a day for 1 week. Do not take it twice a day for 5 days. Do not take it once a day for 3 weeks. You have to stick to the particular time. You have to stick to the course of the treatment, and you have to finish the length of time they've told you to take it for. That's important too, because if you take it for too short of a period, you can end up, the bacteria can end up not being treated. It remains in the system. It multiplies, and now the infection has never left, or it's back with a vengeance. Don't lower the dosage. You know, if they say take 500 milligrams, don't take 250 because it's cheaper. You know, everything's got a reason when you're told to take it a certain way, and so just ensure that you're taking the right dose, the right strength, the right antibiotic at the right time. If the bacteria manage to survive, again, it contributes to resistance. They're living, and so they actually have kind of like a memory system, or like they have like a memory system in which they've now acknowledged, oh, this antibiotic, it has been in the body, been in the system. They study the antibiotic, and then they evolve themselves to become resistant to it. That's how it works. So like I said, you're fighting something that's living. So therefore, it's important, if you're taking something for 7 days, you taking it 2 days less, you leave those few you leave those few bacteria in the system. They learn how the antibiotic works. They become resistant,
and then it doesn't work anymore.
So in the future, you may come into contact with another doctor who wants to give you the same thing. It does absolutely nothing for you.
That's very important, because I know there are some people, because this time it was given to them for 7 days the first time, and then the same antibiotic was given for 5 days, and then they are thinking, okay, last time I had it for 7 days, so why am I having it for 5 days now? So I'm not going to have it more than the number of days, and then they come back and or they take it for maybe 3 days and they are feeling better, then they stop taking it.
That's the most common reason, is that they feel better. And to be honest, most antibiotics do start to kick in by the second or third day, so you will start to feel that relief. And naturally, you know, I know with my family, a lot of my friends, they don't like taking medication, and so the minute they feel better, okay, I only take what I need, and then they let it go. But again, that's fine with painkillers, that's fine with other medications, some other medications, but when it comes to antibiotics, taking it those 2 or 3 days less, depending on the infection that you're trying to fight, can make a huge difference in how effective it is then, and how effective it will be for you in the future.
Thank you. So some of them, I know you don't have to drink alcohol with it, and so let's say maybe you are on it and the weekend is coming, and maybe you are almost on your last one, and some people just skip so that they can drink alcohol. Or when you drink the alcohol with it, does it still work?
Yeah, so that leads me on to like the hazards of antibiotics, is that antibiotics are generally safe, but you can experience common side effects from them. So that can include rash or dizziness, slight nausea, slight diarrhea. When I say slight, I just mean it's manageable. You know, it's there, but it's manageable. In that case, you weigh the benefit versus the risk. You're trying to treat an infection. It's making me go to the toilet a bit more than often. You deal with it for that short period of time. But there are hazards, like you mentioned. There's certain antibiotics you shouldn't be taking with alcohol, because they can cause severe reactions. Now, I met you in a pharmacy, Irene, and I think you must have said it a million times when you were giving out this medication, metronidazole.
Yes.
Yeah.
Yes.
That's a big one in terms of not having it with alcohol. It causes something like called a disulfiram reaction.
Okay.
And literally you can end up being so dizzy, you can end up continuous throwing up, you can faint, you can have hot flushes, you can it's just a really severe reaction.
That's serious.
Yeah. So it's important, if you shouldn't be having alcohol. To be honest, I say don't have alcohol whilst you're having antibiotic treatment anyway. 1 week, 2 weeks is not gonna be the end of the world to put alcohol aside. Some of them are very dangerous, and some of them, the alcohol just inhibits how well they work. So if you can avoid alcohol whilst taking the antibiotic, just take it for the length of time you need to, and then enjoy yourself afterwards.
Apart from alcohol, any other things sometimes you have to avoid whilst taking antibiotic?
Just things to be aware of. There's allergies. So some antibiotics can cause severe allergic reactions. I'd say if you won't know you're allergic to an antibiotic until you've tried it. So if someone says they're allergic to penicillin, it's normally because they were given it as a child and they got a severe reaction. Like I was mentioning earlier, if you get slight diarrhea, slight headache, slight dizziness, that's not really classed as a true allergy. But if it's severe, or if it's something like anaphylaxis, which is a life-threatening allergic reaction, you steer away from the antibiotic, or you also mention it when you're buying antibiotics, because, or check with someone, because some antibiotics you may think, I'm allergic to that one, I can have all the rest, but you don't realize some of them are in the same group, some of them are manufactured in the same way, and so you may have something called a cross sensitivity. You can be allergic to similar ones like it, so it's always important to check, because some of the reactions can be life-threatening. There's also drug-to-drug interactions. So something like warfarin, taking it with certain antibiotics can cause severe bleeds and things like that, because it kind of increases the amount of warfarin. So then therefore it can cause bleeds, internal bleeds and things like that. If you're on methotrexate, it can increase toxicity, which can methotrexate is cytotoxic, so then therefore you're killing healthy cells in the body.
Okay.
So really important to just double check. I'm doctor, pharmacist, I'm taking this. Is this safe to take with it?
Thank you. This is very serious, so please don't take this lightly. It's a serious issue. You need to really make sure you get a proper prescription before you take any antibiotics. All right. We are still here on Akoko Africa Radio UK, and this is Health Talk with Atswei. Geraldine, why are antibiotics becoming a big concern in healthcare now?
So, as I was mentioning earlier, that resistance is becoming a public health threat. So I know in Europe it's a huge deal. The awareness hasn't been raised in Africa, but like I was saying with the World Health Organization, they actually class our region as having the fastest growing rate of resistance. And so this means bacteria will easily spread in the community, because now people's infections aren't being cleared. It's very easy to pass it on to each other. And because they're resistant now, if you've passed on this resistant bacteria to your classmate, your workmate, your family, a doctor will go to give them a prescription trying to treat the right thing, not realizing that the bacteria has grown resistant, and so the antibiotics become ineffective. And the seriousness of it is that it could become life-threatening. You know, you think about young children whose immunity is still developing. Imagine there's babies in the house and you're passing on this resistant bacteria onto them. Their immune system hasn't even fully developed. Or elderly people, their immune system is so suppressed. And there you go. So it's very easy to think, I'm just doing this to myself, but the consequences could be a lot wider. And diseases may take longer time to go away, or they may even become more serious. And the development of, so there's different, with antibiotics, there's different even generations. So they develop them as bacteria are changing. The labs and all the drug development, they're trying to keep up with the rate at which bacteria are changing and becoming resistant. But right now, that development is a lot slower than the rate the bacteria are changing. And so the outlook is that we're not going to be able to keep up and develop more antibiotics to keep up. So therefore, these diseases are just going to become more life-threatening.
Wow.
So people are like common bacterial infections. People are, they could be faced with losing their life, unfortunately.
Well, this is serious. Thank you.
Mm-hmm.
Guys, you can send your messages on Facebook or YouTube or on our website. We'll get Geraldine to answer all your questions for you. Okay. All right. Going on. What is antibiotic resistance you keep talking about?
They call it the silent pandemic.
Wow.
Yeah. So they're basically saying that we may begin to enter the pre-antibiotic era. So when you think of centuries ago, when they didn't have the development of these antibiotics and people were dying of these bacterial infections, like I was saying, we're about to enter into that time of, even though they're around, they're almost useless because, like I was saying, the overuse of antibiotics is basically causing these bacteria to become resistant. And there's a few that I want to talk about. I don't know if you've heard of MRSA.
Yes.
MRSA,
Yes.
commonly heard about in hospital. So they're actually a bacteria that's become resistant. It used to live, it actually lives on our skin harmlessly as we're sitting here.
Okay.
There's MRSA sitting on our skin. And that's why when you go into hospitals, they're very like, okay, there's vulnerable patients here, wash your hands immediately. There's sanitizer almost every 2 centimeters, you know. So it becomes harmful when it enters the bloodstream, or enters the body. And MRSA in 2019 contributed to 121,000 deaths alone in that year, because it causes a serious infection. It can be treated, but it's very, very complicated because you're dealing with a form of a resistant bacteria. And so it requires many antibiotics to try and treat it. But like I was saying, the death rate is rising from it. There's C. difficile. Have you heard of that one?
No.
No. It's a type of bacteria that can cause diarrhea. So this one's quite important. It lives in our gut harmlessly. So it actually lives in the gut, and when you take antibiotics, they sometimes kill the healthy bacteria in the gut, and then this C. difficile starts to rise.
Okay.
And then it can become harmful, the amount that's in the body, and so it can cause diarrhea. So I was mentioning diarrhea. When I said slight, I was trying to indicate that when it's just manageable,
yeah,
it's classed as a common side effect. But when it's severe, or when you take certain antibiotics that cause it, stop it straight away and go straight to a doctor. Try and get medical advice, because this C. difficile is a spore-forming organism, and it can survive antibiotic therapy, and it germinates, and it can relapse even after you've had treatment. It can relapse, come back with a vengeance.
Wow.
Yeah. And it's resistant to so many antibiotics at the moment, so now it's becoming harder to treat than ever. It's adapted so quickly. So like I was saying, if you get that severe diarrhea, stop the antibiotic you're taking and just seek medical advice. And last one is tuberculosis. There's now a multi-drug resistant version of tuberculosis.
Wow.
Yeah. And tuberculosis affects the lungs, as we know. And it spreads through the air when people cough, sneeze. That's how they pass it on. But worldwide, TB is the second leading killer after COVID. So it's actually higher than HIV and AIDS. TB.
Oh.
So when it becomes multi-drug resistant, it's a 6-month treatment that's normally used to treat normal TB. But when it's become resistant, to 2 of the drugs they normally use to treat TB, and now it becomes even more difficult to treat. And in 2022, 1.3 million people died from TB. So even though we developed that vaccine time ago, you see, now that the people that were getting it and passing it on, it's now become drug resistant to two or more of the antibiotics used to treat it, and so now it's come back with a vengeance.
Oh my God, this is bad. Are there any other diseases that the antibiotic resistant cause apart from those two?
Three?
Yeah.
Yeah, there's many. Think off the top of my head. Trying to think. Those ones are like the ones you watch out for mainly. But
those three. Tuberculosis is a very serious one on its own, and if it cannot be cured, then it's going to be very, very dangerous.
Yeah.
And looking at Africa, talking about Africa itself, the way the place is, and we have to do something about it.
Yeah.
What would you say, apart from us trying to create awareness and all that, what else can we do to help? Because it looks like a very, very serious issue.
Okay. So there's ways to help on an individual basis. So you individually, like I was mentioning time and time again, making sure that you're taking it ideally under a clinician's advice. You're seeking that prescription for it. Or even if you are going to be sold it over the counter, don't buy it unknowingly. Get advice from someone that is trained and aware of how to treat bacterial infections. Responsible use and making sure you're taking it for the right period of time and under the guidance of a clinician. And general hygiene, to be honest. Washing your hands when you're feeding people, etc., etc. But on an individual basis, it's very important. You're just taking it as prescribed. That's the underlying basis, because even where I work, they're kind of making it very important to all of us that are prescribing, that we're giving the right antibiotic at the right time, that we're seeking, if we can, we're doing investigations, we're giving antibiotics face to face. We've seen the patient, we've looked at their symptoms, we've looked at the resources, we've checked it against it, and we're backing up why we're prescribing this antibiotic, not just ticking a few boxes and giving it easily. Yeah. and so that leads on to in terms of healthcare professionals, so for any doctors listening, nurses, pharmacists, just start to monitor antibiotic resistance or antibiotic use at your health facility and at your clinic. Collecting data. I recently did an audit at my place of work, so it was in a doctor's surgery. I did an audit, and we're looking at how the doctors were prescribing a certain group of antibiotics. And we were looking at the guidelines. We were making sure the doctors were prescribing, and sometimes they were, sometimes they weren't. But they were grateful for the awareness, and when they realised the facts of how you're contributing to this this growth of resistance, it just makes you more aware as a clinician. Investigate where you can. Like I was saying, take temperatures. Sending off samples to labs. I know that might not be as easy back home, but even if you take a temperature, even if there's certain toolkits, like the World Health Organization has an antibiotic book called Aware.
Okay.
And I was reading that, and it literally goes through different conditions, viral, bacterial, fungal, and it tells you what symptoms to look for. How long to prescribe an antibiotic if it needs an antibiotic. It can even tell you don't prescribe. The patient should be fine within 2 weeks, if not revisit. So that's advice you can give, this thing you're suffering from, give yourself 2 weeks. We're not going to treat for now, and we'll see how you are, and so the book is a PDF. Anyone can download it. Any doctor can download it. And it's very simple, very easy to read. Yeah, that's ways we can slow down this resistance.
Thank you very much, Geraldine. Thank you very, very much. This is very, very good. Let me go into our page and see if we have some questions here for you.
Okay.
Okay, I have a few questions here.
Yeah.
Somebody was asking, AC, do antibiotic make you fatigued, like tired or something?
Yes. So as I was mentioning, common side effects can be dizziness. More than likely, the thing that's causing the fatigue is the bacteria itself, the infection itself.
Okay.
You've got to remember, you've got the assistance of the antibiotics, but your body's also trying to fight. When the body's fighting, there's certain things that can happen. Tiredness being one of them. And so it's less likely that it's the antibiotic causing tiredness. It's more likely the bacterial infection itself. Yeah.
Okay. AC, there's your answer. Thank you. Rose Johnson, I think we've already spoken about this, but she's asking, can you drink alcohol with antibiotics? That's her problem.
Okay. My advice is that there's some antibiotics, like I was saying, the reaction can be very bad. It can cause that severe reaction where you're just projectile vomiting and you're fainting. That one, stay away, the metronidazole. But others, it's not so much that you can have a reaction like that, but you may be inhibiting how well the antibiotic's working. And so if you're on it for a short period of time, and I classify that as less than a month, I would advise avoid alcohol just for that period of time. Get over your infection and then resume. If you're on antibiotics, some people are on antibiotics for 6 months, in that case, there are antibiotics you can drink in that case, but in moderation. And I'd probably I don't know, do you use units back home as measurements of alcohol? Units?
No, I don't think anybody measures that.
They measure it by the bottle.
Yes. I think they have a small glass, they call the tot glass. Yeah, that's what they use.
Okay. Yeah, that would be my advice. If it's less than a month, avoid. If it's 6 months treatment or that prophylactic thing where I was mentioning, where you're taking it every night for long periods of time, take alcohol in moderation. That would be probably the equivalent of, I think, 4 glasses of wine a week. Something that's moderate or less. You keep it to that. It's not a lot, but you keep it to that. Yeah.
Okay, Rose Johnson, don't drink when you are taking antibiotics. Simple. Our next question. Okay, this is from DJ Cobb. It's not a question. It's very interesting and informative.
Thank you.
Juliet Mills said, should you eat before taking them?
Oh, okay, so it depends on the antibiotic. So some of them definitely, because they can create stomach upset. The nausea can be worse than if you had just eaten before. But some of them it's actually better before food. So it's very important. Again, this is where it ties into checking with a clinician first. Flucloxacillin, that is normally used to treat skin-related infections. That one is to be taken on an empty stomach, so half an hour before food, because having food first can the medication can bind to it and not be as effective. And then on the other side, there's some where you eat first because the nausea can just be too much, or the stomach upset. So again, seeking that advice. There is a difference. There are some with or without food is fine. Amoxicillin, flucloxacillin before food, metronidazole after food. So just getting the advice first is important.
Okay, thank you. When you were answering one of the questions, you said something about maybe being on an antibiotic for a month, or how long do you have to be on it before it becomes resistant?
So resistance, if I'm honest, because it's such a we're dealing with a living thing. I feel like they're constantly studying it. So like I was mentioning to you, here in the UK, in my surgery, they're advising that now a lot of antibiotics that were for 7 days, we're cutting now down to 5 days to kind of slow down that resistance. There's no fixed time. It's just taking it unnecessarily or taking it incorrectly can lead to that resistance. Taking it for too short of a time, taking it for longer than needed for that particular infection, it can cause resistance. So there's no fixed time. It's just taking it outside of how you were directed is taking it the wrong way and could lead to resistance.
Oh, okay. Thank you. Juliet's mail again. She said, do they upset your stomach?
Okay, so like I was mentioning, food-wise, some of them, yes. Everyone's different when it comes to medication, and this could be from blood pressure medication, this could be from cholesterol medication, diabetic medication. One person's reaction might be different to another's. And so if you're allowed to take it with food, I would advise taking it with food. That can reduce stomach upset. But some of them, like I was mentioning, if you take food first, you are prohibiting how well it will work.
Okay.
So where it's not important or where you're advised to take it with food, definitely do that, because that can reduce stomach upset. But also, every individual is different. So what may affect me may not affect you. So I can't guarantee that they don't cause stomach upset. But I always say risk versus benefit. If you've got a slightly upset stomach, but you're fighting a chest infection, just bear with it.
Yes.
Maybe take something, Pepto-Bismol or something to ease the stomach, liquid magnesium, just to ease the stomach, and milk of magnesia, just to ease the stomach whilst you take the antibiotic.
Okay. All right. Thank you. This is from DJ Kobe. Can I drink coffee while taking antibiotics? Yes, you can. Caffeine actually is said to increase the absorption. No, speed up the absorption of Really?
medication.
I thought it would be no, because he.
Maybe I'm biased because I'm a coffee drinker as well.
Oh, okay.
So nothing can separate me from my coffee. No, I'm joking. Yeah, you can drink coffee with antibiotics. Yeah.
Okay. DJ Kobe, you can drink your coffee, don't worry. Nothing will happen to you. Rose Johnson says thank you. Julia says thank you. Great advice. Please keep bringing your questions. At the moment, I don't have any questions. We'll move to our next level. So, Geraldine.
Yes.
Tell us, what else have you got for us today?
So I like games. I like fun. So I found a quiz.
Okay.
It's friendly. It's not too crazy.
Okay, now I'm on the hot seat.
Yes, you're on the hot seat. So it's a quiz just to see how much the audience have learned, and because you're the one I'm talking with, you're the one being quizzed.
Yeah, I'm gonna wait for them to answer here. So everyone listen.
Okay.
Listen and give me your answers.
Okay. So question 1. Antibiotic resistance is when an antibiotic no longer works. The more you use an antibiotic, the more bacteria become resistant to it. True or false?
I know, true.
Number 2, antibiotic resistance is just a UK problem and it is not a problem worldwide. True or false?
No, that's false.
Antibiotics have no side effects.
They do.
So that's false.
That's false, yes.
Okay. Antibiotics may help virus infections such as colds get better more quickly.
That's false.
See, guys, Irene,
I'm winning.
and she's actually a pharmacist herself. she's been in the field long enough. She knows so much. So
Oh, no.
I knew this quiz would just go.
I am winning. Oh, Okay, some people are answering here, so I'm not going to answer now. I'm going to look
Okay.
here.
So, buying antibiotics in other countries won't affect antibiotic resistance in the country you're in. True or false?
I'm not answering this. I'm waiting for you guys. So, Juliet says false. DJ Kobe says false. Rose says false. I think it's false.
True. Not treating minor infections with antibiotics, which would get better without, is a way of reducing the development of resistance.
Oh, the question again.
Okay. So not treating minor infections with antibiotics, which would get better without them, is a way of reducing resistance. So in other words...
Yeah.
Yeah?
That is true.
That is true.
It's true, yeah.
It's true.
Let me see. I'm waiting. Okay, DJ Kobe says true, or AC says true. Who else? Again, everyone got that. Okay,
Yeah.
what's the next question?
Taking antibiotics at a lower dose than prescribed will help prevent resistance developing.
No, false.
True. I mean, it's true that it's false.
Yes, false.
Yeah, that's really important. Like we were mentioning before, you're told to take 500 milligrams, don't take 250. The UK government, sorry, this is UK specific, but the UK government is concerned that there are few new antibiotics being developed. We can put that on a global scale. The global healthcare system is concerned that there are a few new antibiotics being developed. So the development of antibiotics is few. True or false?
True. Oh, I got that.
True. Buying antibiotics over the internet is not recommended because antibiotics should only be taken when prescribed by your healthcare provider.
That's true. Juliet says it's true as well.
Yeah.
Rose Johnson says it's true. Okay.
You should take your antibiotics as prescribed by your doctor because the infection may not be completely killed if you do not follow the instructions. This could allow resistant bacteria to then infect you.
That's true.
True. And that was question 10. So
Oh.
you all got 100%.
Yes, so what are we getting? A lollipop?
A round of applause.
Thank you so much, Geraldine.
Thank you.
Thank you. This has been very interesting. And so, before we leave, is there anything else you'd like to tell us before we leave? Because we bring the show to an end now.
I just hope, that it was quite a simple message. It wasn't too clinically advanced. It was just to drive home that message of, especially back home, the rate at which we're taking antibiotics, you're doing more harm than good, not only to yourself, but to your community. Like I was saying, the passing of this resistant bacteria is causing life-threatening conditions to a lot of people. And so if you can just take that into consideration every time you take an antibiotic or buy some, just be more aware, try and seek advice, and yeah, that's it really.
Thank you. Rose Johnson said, when are you coming again?
I will come as soon as I think of another topic. Please write your topics of interest. Maybe I could do some further reading and research, and I can present to you something you are interested in. So yeah, thank you for listening though.
Okay, she said, I love the questions. Thanks so much.
Oh, thank you.
So, Geraldine said, bring the topics you want us to discuss, and then she will come back with that. So the ball is in your court now. Everything depends on you. If you want Geraldine back, let us see. Bring your questions, and then we'll do that. All too soon, we've come to the end. Very, very interesting today. And I'd like to take this opportunity. Oh, do we have another question again? Juliet Mills said, thank you. Great advice. Is there any other question I'm missing?
No.
Thank you very much. Thank you. I'd like to thank you so much for coming on the show.
Thank you.
It's very, very informative, and we've learned a lot today. I've learned a lot today. And in all of us, in our own small ways, we'll try and do the best we can to help, especially Great Africa.
Yes, Mama Africa.
And you can tell my listeners want you back here.
Oh.
So very soon, we'd like to see you back here again.
Thank you. I'd love to come back, and I look forward to it.
Thank you very much. This is Akwoko Africa Radio UK, and this is Health Talk with Na Atswei. We've come to the end of the show today. We hope you learned something, and if you have any other topics you want us to treat, please let us know. Send us messages on our Facebook, our WhatsApp, and every other place we are, and we will bring it to you. And is that going to be?
Yeah, there'll be a show.
Okay. There will be Shepherd's Hour with AC tomorrow. So please make time with her. You know she's always bringing us something new and very, very inspirational. So make time with her. There will be no Kobe show as usual for now. So till we come back again, have a good evening.
Julia's a great show.
Oh, thank you. Julia says great show, and thank you.
Thank you.
Rose say thank you.
Thank you.
Everyone
too.
say thank you.
Thank
All right. So you all have a nice weekend until we come back again.
I know we're in the meeting.
Stay alive. And remember, a beautiful day begins with a beautiful mindset. You have a very nice weekend. Bye from us.